What's up, y'all? This is Not a Real Doc DPT, and no, I'm not a real doc, but I am a licensed and practicing doctor of physical therapy. And in today's video, we're going to be talking about what are the things that you should know about and expect before your back surgery. So, back surgeries, eh, they're notoriously successful and unsuccessful. I don't want to say that the risk is 50-50, but depending on what you're having done, that could be the case almost. Success rates on back surgeries are not as high as they are for other more orthopedic areas, such as a knee replacement, a hip replacement, something like that. Usually well, at least it used to be said that we would say if you're having like a back fusion, that there is a 50-50 chance that fusion is going to go well for you. So I think those numbers have gotten a little better, um, but when you look down the road, the success rate of those fusions, um, I don't want to say more often than not, but they're not always successful. You come 1 or 2 years down the road, oftentimes patients develop pain again, and then they develop issues, typically above and below the areas of the vertebra that were actually fused. Then you start looking at needing to potentially have another surgery on those areas, and it just can kind of creep up and down your spine if you're not careful. But that's what physical therapy is for. That's what our job is to help you to stabilize your trunk and the whole area of your spine, trying to help with then improving mobility as much as you can after you've gotten that initial stabilization taken care of, and improving the mobility of the area that was fused. But so I say that to say I don't want to scare you away. Sometimes surgeries of the spine, they just have to happen if you have, if your leg is on fire because you have a ruptured disc, let's say, if you had trauma of some sort and you had a fall and you fractured a vertebra in your spine, those types of situations you really can't do anything about, and so you are forced into the situation. So and that's not to say that you can't get back to a good function and a good full function, quote unquote, um, with therapy and with exercise and with taking care of yourself. You certainly can. It just is going to take more work. So when you're looking at a spinal surgery, I would say the first thing that you should really think about and understand is it is not something to just go to just run into without having some good understanding of what is going to be required of you in the big picture. Um, so you want to have a make sure that you are fully discussing all options with your surgeon. You want to make sure that you maybe have done some pre-physical therapy before the surgery, in addition to physical therapy after the surgery. But that's when you're looking at fusions. And let me come back. Back surgeries are not all the same. There are things such as laminectomies where they are just removing, say, areas where arthritis has developed. Those types of surgeries can actually be very successful. I would say the rule of thumb is for back surgeries, the the if the less that they're having to actually install and put into your back, the better off you're going to be. And if they're just removing things, you're going to be even better. So your success from those surgeries and the risk of that the surgery is going to entail for you is going to be more related to, let's go back and say, the invasiveness of the surgery in general, which is kind of what you would expect, right? Um, but I think sometimes patients just don't quite understand that. They think, oh, well, I'll just have the surgery and I'll take care of the issue. And that's not always the case. it's, back surgeries can be a little tricky, and so that's what you need to understand. It's not as successful um, as a hip replacement or a knee replacement, I would say, but it also depends on the type of surgery. So, um, the also you should have an expectation that you are going to do physical therapy after your back surgery. And again, the less invasive that the surgeon is required to be in his or her surgery, then the less that you will actually need that. But most back surgeries, you're going to come home with home health physical therapy, and then depending on the invasiveness, depending on your uh, how in shape you were before you went into this surgery, and the nature of the surgery itself, you may progress from home health physical therapy to outpatient physical therapy, or it may be home health physical therapy is all that you do. But typically, you would say that a patient is going to require physical therapy. Typically, you're going to be using an assistive device when you come home. Again, the more invasive that the surgeon is, the more likely it is that you're going to use um, a stronger, not stronger, a more stable assistive device. So you may be using a walker for a week to 2 weeks. Then you may progress to a cane, and then you would progress to nothing at all. Or it may be that you are going with a cane for a week or two, and then go from there to nothing at all. Again, that is going to be very relevant based off of what the surgeon actually did to your spine. Did they have to add a whole bunch of stuff in, or were they just taking stuff out and it was a more basic type of surgery? You may come home with a brace, like again, if you're having a fusion, and working on an area. If the surgeon's doing something that he's going to inherently make your vertebra unstable, then they're going to give you a back brace to come home with. This is a brace that will wrap around your entire trunk, and then it's sealed with Velcro. It's generally hard in the back. There's generally some plastic pieces there that are giving you some stability in the spine, and then it's generally Velcro coming around to the front and more soft on the side and stuff. You may come home also with back precautions. Typically, again, with fusions of the spine, you're going to generally come home with a back surgery precautions, so that you are not going to want to do any bending of the trunk. You're not going to want to do any lifting of the trunk. Although I say that, usually that is qualified according to the amount of weight that you're lifting. Um, excuse me. And that weight is typically somewhere in the 10 to 15 pound kind of a range. And then there's going to be no twisting as well. Your physical therapist at the hospital should teach you how to do like a log roll to get into and out of the bed, so that you are kind of moving your trunk and your legs as one, so that you can avoid that twisting kind of motion. So those are usually some of the things that you'll have coming home after your surgery, looking at assist devices and sometimes some braces. If you didn't have a fusion, if it was just a laminectomy type procedure, then they very well likely are not giving you a brace at all. It might not be necessitated. Um, you also uh, you're gonna, as far as returning to work, as far as returning to driving, those types of things, you're going to want to talk to your surgeon about that. A lot of times, patients will look to the physical therapist to answer that question, but I and most most PTs are going to probably bounce that answer back to your surgeon, because it's usually that's what Medicare is looking for anyway. It's more what the surgeon is thinking, more so than the physical therapist. So their opinion being that they're the ones that actually did the cuts and they did the surgery to you is going to hold more weight in that venue. So um, when you can return to those types of activities, and we'll say address with your surgeon again, you would, in general, think somewhere in the 4 to 6 weeks, if not a little sooner. Everybody's going to be different. And that I should also qualify that uh, your progression here with this and your progression using assisted devices and the type of assisted devices, it's not just going to be a factor of the type of surgery that you had and how invasive or non-invasive it was. It's gonna vary based off of you, a person. How in shape are you? Were you in good shape going into the surgery? Were you not in good shape going into this surgery? That's going to affect how long you are looking at as far as your recovery goes, as far as how quickly you'll get back to returning to your prior level of function, or hopefully, Lord willing, better. That again is going to depend on you and how much work are you actually having to do to get back to that versus were you already in pretty good shape and you took care of yourself already, and so you may move a little quicker through that progression. So um, I think that's the main things. I look at my notes here. Those are really the main things that I wanted to touch base with you, just to make you aware of, and just to put some points out there. You may, for the first day or two, need some assistance with your activities of daily living. So that's going to be, dressing, showering, those types of a thing. You may you may want to plan for a day or two worth of help on that. But again, everybody might be a little bit different. Um, but in general, the less invasive that the back surgery needs to be, the the better chance that you're going to have a successful outcome afterwards. And you want to keep in mind that it is going to be work to recover, and that's why you're going to want to seek out physical therapy care to help you do that. So I hope that this video has been beneficial to you. I hope that it's given you a few answers. Kind of these are questions that a lot of times we'll get from patients before they're actually going into these surgeries. So there's not like a lot of scientific detail to this because that's not what this channel is even about. So this is all meant to be more patient focused, and so I hope that this video has given you a little bit of answers and helped you to know what to expect from your upcoming back surgery. And I hope that goes well for you. And um, tune in to the next video that we do, and that's going to be on what you should expect after your back surgery, and we'll talk about a few more details of that at that time. All right, y'all have a good one. Bye.